Thank you very much. I'm Dr. Dan Eli Aniku. Procedure for doing IVF requires really couples need to work together. When we're doing IVF, basically what we are doing is to, number one, to prepare the mother in such a way that we want to harvest as many eggs as possible during the process of IVF, because you know that at times when you do the IVF for the first time, it may not take up. So what you want to do is to be able to stimulate the ovaries of the mother, so that you can be able to harvest as many healthy ovaries, the eggs for that matter, as possible. And after doing the ovarian stimulation, then what you're going to do is called egg retrieval. We'll have to get all the eggs that have matured from the ovaries, and then immediately after the eggs have been retrieved from the ovaries, then they undergo a fertilization process. We can have what is called a conventional fertilization, where the eggs are mixed with there's a sperm in a particular proportion. In most cases, you would want for an egg you need like over 20 million spermatozoa, or you can do what is called as intracytoplasmic sperm injection. In this case, you identify a good quality sperm and then you inject it into the eggs which you think are of good quality, and then after that, usually the zygote is allowed to undergo maturation. So during IVF time, you want to monitor that after the fertilization. Number one, you want to confirm fertilization. After confirming fertilization, you want to see that the zygote now starts undergoing through a normal development. That is, they must now go into what is called cell division. So we know that maybe on the third day there should be about 8 cells. The division should have gone to around 8 cells, and that is what is anticipated. So when the embryo is undergoing through the normal cell division or development, you know that yes, you are doing well. And then maybe on a 5th day, you want to see that the cells have divided much more, but also there is a blastocyst, usually a cyst which forms. And then when that forms, you know that this embryonic development is following the anticipated patterns. And then you will now want to transfer the embryo, good quality embryo, into the uterus of this lady. So usually when you are doing the process of ovarian stimulation, you also you want to confirm that the endometrium is also prepared to receive the baby. So there you need to do ultrasound to look at endometrial thickness. You want to do tests like estrogen levels to see that it has risen to a sufficient quantity. That one will be able to give you a picture that the uterus is ready to now receive the embryo, and then that's when you do an embryo transfer. After embryo transfer is done, then you wait for like 14 days, and that's when you'll be able to test for pregnancy, because you would expect after 14 days there should have been sufficient development of trophoblastic tissues, which usually produces the HCG, which is what we test to confirm pregnancy. Once that is done, and then the mother will have to be transferred now to obstetrician. In the process of doing all this, usually we do a lot of hormonal support, especially after immediately when the embryo is being transferred. Also, we start giving progesterone supplementation, which usually helps to keep the uterus quiescent. Thank you very much.